If you're an IBD patient, it can be exciting to start a new medication and feel like it's having a good response, but then frustrating when that response seems incomplete. And in this video, we'll discuss how to distinguish an incomplete response to medication from a complication of the disease or something else altogether so that you can proactively manage your IBD. The first thing to understand about IBD medications is that they can take effect at different rates. Some of the biologic therapies like Humira and Remicade can have very prompt responses, and within a couple of weeks, you'll have a pretty good sense if you're responding to this medication. Other biologic therapies like the anti-integrin agents such as Entyvio take longer to provoke a response. It can take several months. The same is true of Imuran or azathioprine. And when you're on these medications, you'll often be on a longer steroid taper to bridge that gap while the medication takes effect. And knowing that time of onset helps you judge whether you should be having a response to this medication or you should be patient. After allowing ample opportunity for this new medication to take effect, your symptoms are our best guide to whether you're having a good response. But not all symptoms are caused by the inflammation that these medications help to control. There can be a lot of other factors, mimics of IBD, infections that complicate the situation. Patients with IBD are susceptible to GI infections, and so undercooked chicken that might ruin someone's barbecue picnic can wreak havoc on a patient with IBD. Many of the diarrheal illnesses cause a bloody diarrhea, and those symptoms can be almost indistinguishable from an IBD flare. Patients with inflammatory bowel disease very often have irritable bowel syndrome. And while inflammatory bowel disease is an inflammatory condition per its name, irritable bowel syndrome actually has nothing to do with inflammation. And so medication can control your inflammation really well, but your irritable bowel symptoms can persist. And so distinguishing those is an important factor. Patients with inflammatory bowel disease often adapt their diet to help them minimize their perception of abdominal pain and other symptoms. And yet those same changes may provoke diarrhea. For example, if you're making juices that concentrate a lot of fruit sugars, that may provoke diarrhea. If you're making a smoothie that blends in some milk or other dairy products, then if you're lactose intolerant, that may provoke diarrhea. And so these factors can confuse a patient with IBD because it seems like their diarrhea continues even after they started their new medication. IBD medications are meant to control inflammation, but they can't undo some of the past damage of the disease. If a patient has Crohn's disease that has developed strictures, these might be scarred down. And the IBD medications are not going to reverse that. And those strictures can continue to cause symptoms of having difficulty passing stool and pain. And so these patients will continue to have symptoms even though their inflammation is very well controlled. And they may ultimately need surgical management of those strictures. So how can we distinguish symptoms that are caused by inflammation from symptoms that are caused by an infection or some of the chronic aspects of inflammatory bowel disease? One thing that is very helpful is to get blood tests that are markers of inflammation or stool tests that do the same. And these labs are especially helpful when they were secured earlier in the course of disease so we can see a comparison. And what we're hoping to see is that while these inflammatory markers were very high early in the course of your disease prior to starting treatment, they have come down and calmed after the initiation of a new therapy. Labs can also be helpful to monitor if drugs are reaching their therapeutic targets. We don't have therapeutic drug monitoring for all medications, but this is particularly helpful for azathioprine, Humira, Remicade, and some of the other biologic therapies. Finally, it can often be helpful to get labs that can identify infections of the GI tract, which is done with stool cultures and other special studies of the stool. Depending on a patient's exposures, it is particularly helpful to be looking for specific infections such as Campylobacter, Clostridium difficile, or Entamoeba histolytica. The most definitive factor to determine if inflammation of the GI tract has calmed is to perform a colonoscopy or a flexible sigmoidoscopy. If we take a look at the colon and it's healed up, that's great. And if we can take a biopsy and confirm under a microscope that inflammation has cleared, even better. However, when Crohn's only affects the deeper parts of the small bowel, it's difficult to reach those to directly visualize if the inflammation has calmed. And so in those circumstances, it's more helpful to perform a CT or MRI, especially an enterography, which specifically identifies inflammation in the small bowel to see if those segments of the GI tract have resolved inflammation. These factors of your symptoms, labs, and imaging come together to determine whether you're having a good response to a medication or it may be losing effect. Subscribe to the channel to learn more about IBD, how I manage a flare, and how I go about changing IBD medications. Thank you and be safe.